Welcome to the Food Junkies Podcast. Here, we aim to provide you with the experience, strength, and hope of professionals actively working on the front lines in the field of food addiction. The purpose of our show is to educate you, the listener, and increase overall awareness about food addiction as a disease with abstinence as the solution. Here, we talk about all things recovery. Most importantly, how to thrive rather than just survive. So stay positive, make a change for yourself, tell others about your change, and hopefully the message will spread. Hello, everyone, and welcome to the Food Junkies Podcast. We are really excited about the episode today because we are talking all things kidney with Dr. Robin Rose. We are all aware of the damage sugar does to the brain, heart, liver, and gut. But what about that magical bean-looking organ, the kidney? Today, Dr. Rose shares her personal experience with kidney disease and why giving up sugar was a big part of healing her kidney. I also think moving to Hawaii helped. She gave Vera and I a little tour of her backyard, which was like this magical garden, and you'll hear the birds singing in the background. So that definitely, I think, might have played a part. But anyways, what I most appreciated about this interview was her explanation of what the kidney does, why it is important, and some questions we should be asking ourselves about our own kidney health. Pay close attention to how she explains exactly how having poor kidney function or kidney damage affects our melatonin levels and vitamin D production. If kidney is not working properly, this may be one of the reasons we are struggling with sleep or experiencing low mood and/or depression. What we love about Robin is her passion on informing and educating physicians on early intervention for increasing kidney function and her take on what she calls renology and what that actually involves, which she will share with you today. We know you will enjoy hearing her recommendations for how someone with kidney damage should eat and what they benefit from removing from their food plan. Of course, sugar is definitely on the list. Listen in as Vera and Robin dive deep into why taking care of this organ is so important for our longevity. Enjoy the show.
Okay, welcome to the Food Junkies Podcast. My name is Dr. Vera Tarman, and I am your co-host today along with Clarissa Kennedy. Today, we are talking to Dr. Robin Rose, a Hawaiian medical doctor who has a specialized interest in primary care nephrology. She received her family medicine training in Santa Rosa, California in the 1990s, and then after a personal scare with kidney disease, she focused her private practice and passion for people with chronic kidney disease. It's no surprise to us at Food Junkies that she too has strong opinions about sugar addiction and how it affects kidney as well as our general health. So welcome, Dr. Rose.
Thank you. Thank you so much.
Please, let's start, if you don't mind, telling us, we always like to get a little bit of the personal story first. What was your experience with kidney disease and how did that bring you to an awareness of sugar addiction and the role of sugar in kidney disease? What was your aha moment?
The aha moment was the day I got a call from a radiologist to tell me that the scan that I just had revealed a 5-centimeter kidney tumor.
Wow.
That was a bit of an alarming moment. I was actually on my way to be moving to Hawaii at that point, and that got my attention. You know, the rule of thumb is that we can live with one kidney. That's not exactly pure truth. But I walked in and asked for a nephrectomy because I wanted the tumor to be gone and was reassured, you're fine, don't worry. So off I went to move to Hawaii 3 weeks after major surgery. It was kind of an ordeal, but well worth it. And 3 months later, I returned to Oregon where I'd been living to do a follow-up CAT scan and just, evaluate things. And the next aha moment is we can't give you contrast. I used a few 4-letter words. It was Christmas Eve and found out that my GFR was at the bottom of stage 3, which is kind of the intro to really declining. And I saw a nephrologist who basically just said, don't worry about it. People live 30 years with this. Have any advice? Well, nah, don't worry about it. He told me he himself ate a plant-based diet. I asked him if he suggested I do so. Nah. So as a primary care physician, I had to look in the mirror and realize that primary care is not up to speed with kidney. And so that really was the beginning of the aha. And I'll just go a little bit of basics. Is kidney disease. Most people think of kidney disease, the first thing they do is run into, are you on dialysis? Dialysis is like decades later. And so my question became, what happened before all this? And at the time, with a GFR in the low 30s, my brain wasn't really working.
You know what? You're talking terminology. So you mentioned stage 3 and you mentioned GFR. Are you going to explain that, or can you just give us a little primer right now so that we can follow your story?
So dialysis is end stage.
Yeah.
Basically, people cannot live without being on life support. And it was discovered in 1960, and all of a sudden, all of the advice that we were giving people with kidney turned into a pathway to dialysis with a lot of negativity and not a whole lot of lifestyle. And as a physician, I was always a lifestyle-induced, nutrition-inspired physician. And sugar has always been something that I advise people to avoid, just as a segue into why we're doing this talk. And so the process to get to end stage starts somewhere. And the staging was set up by some international group of nephrologists. And stage 1 is almost ignored. GFR stands for glomerular filtration rate, and that's the thing you see on labs, as well as creatinine. Almost every panel that a doctor orders, you'll see that on. And so stage 2, which I think is where we in primary care need to start looking, is considered normal. So the GFR, the filtration rate at 60, is the cutoff rate in nephrology. And my thought as a original thinking primary care physician was, wait a minute, in my realm, I'm not a nephrologist. In my realm, I want to start looking at this early, because stage 2, there's plenty of stuff that's broken. But we don't really start telling people you need to be concerned about kidney until this number of 60.
Which is the difference between 2 and 3?
Yes. And so if you think of full function as 120, just a number, GFR of 60 is 50% loss already. That's a concern to me as a primary care physician. And what I realized is I didn't know enough about kidney to even talk to myself.
Actually, so could we stop you there? And could you just give a quick definition? What does the kidney do for us, for those of us who have no idea? Because we know lots about the liver, lots about the brain, but we don't know anything about the kidney. Right. It's unbelievable.
Exactly. I mean, even physicians who are not kidney specialists really don't understand the array. Everybody knows the kidney's a filter. Whatever the body doesn't want that goes out in the urine goes through this delicate little amazing organ. I mean, it's way more complicated than I ever imagined, but it does a whole lot more than that. That the effect on almost every organ is known. And I've kind of been working on going through a survey. How does kidney affect the brain? How does kidney affect the eyes, the nose, the ears, the throat, the swallowing, the stomach? It's so amazing. And so when kidney function decreases, things like gout happen, things like multiple myeloma, hyperparathyroidism, and so it's really a systemic disease. It affects the whole body. Cardio disease, so stage 3, which is a GFR between 30 and 60. So you're thinking from 25% to 50% function, not much. And yet we still neglect it. Yeah, we give people blood pressure medicine and diabetes medicine and cholesterol medicine, all useful. But in my practice, I've always tried to get to people earlier than when they needed the meds and start making changes. And I've been very successful with that because I was kind of continuing. I just mentioned it once.
So I'm going to interrupt again because I still want to, I'm thinking for our listeners. So if somebody only has 50% kidney function, what is it that they're not able to do? What can't they filter anymore? Like they can't filter the uric acid, which then leads to a buildup, which then leads to gout, for example?
Yeah, I mean, proteins. I was just reading insulin doesn't get excreted as well.
Okay. And so then you get a buildup of these toxins that should be peed out, essentially.
Exactly.
And then cause all these illnesses.
And we don't even know the array of them. They call them uremic toxins. Every year, the list of what really does harm kidney and what kidney causes to rise, it harms other parts of the body. It's very significant. It's way more than just filtering. I mean, anemia is an issue. Melatonin is an issue. Vitamin D is an issue.
Wait. These are all interesting things. How is melatonin? How is anemia? And what was the other one? Vitamin D. How are they impacted?
The kidney is a busy little thing. It's a little busy bean, and it packages stuff up. So the liver makes one form of vitamin D that's not active. The kidney finishes up the production, and then we have access to active vitamin D. So with decreased kidney function, you might not have enough vitamin D, and
that's a chronic problem in society right now.
Huge.
Yeah.
And kidney disease, by the way, is very pandemic. It's way more of a pandemic than the one that's in the news. It's so enormous. And, the thing that I walked into this is we can't neglect it until later stage. We have to start early. And in fact, the thing that with kidney that's concerning is whatever causes it, and it can be a cardiovascular cause, it could be a diabetes metabolic cause, it could be cancer, it could be autoimmune, toxins, infections, accidents. Many things can hurt kidney, and it doesn't really matter what, because, it does, but the end point is inflammation at a cell level. That means all kinds of cytokines. We all have heard about cytokines. It's a big deal with kidney. And then fibrosis, so scarring. And just like in the heart and the brain, this other major organ, once it scars, it doesn't work well. But earlier, you can actually intervene before the fibrosis, before it scars. If you change your ways, you can actually reverse some of the damage. And I've seen it. I've seen people go from, a less 20% function up to 40% function, 50%. Every bit of that matters. I can tell you the difference in how my brain was working when I was at, 26 or 7% compared to currently I've gone from about 25% to just about 50%. With effort, with a great deal of effort. And one of the things that I did, seg into our intention, was I gave up sugar. I've been saying I should give up sugar for, the last 25 years. And it's an unfortunate reality that many of us wait until, Maxwell's silver hammer bangs them, and then I'm doing it. I'm changing. And so part of what I like to help people understand is we are in a toxic world, and kidneys are vulnerable to these toxins. So we're all concerned about kidney. Whether your numbers show it or not, it's a big deal, And so with sugar, we also know that it is very dangerous to blood vessels and to the heart, to the brain. And yet, all of a sudden you go, oh, wait a minute. They used the cholesterol card and said, sugar's okay. It's the fats. But actually, I'm very blessed. I had some very good nutrition teachers early on, and I heard this. It's not the cholesterol, it's the sugar. Not that cholesterol is nothing, but we've neglected the fact that sugar is, some of the details that I found in preparing to do this talk with you is that historically people ate 3 pounds of sugar a year. That was it. And now we're up to like 70 to 80 pounds as a statistic. And, unless you're a passionate cook, you're getting ridiculous amounts of sugar every day. And, it's lovely. I can't say I don't still love sugar. It's just we broke up. It was like a bad boyfriend who hurt me. I'm like, you stay over there. And, with kidney disease, I had low blood pressure before this. Now I have high blood pressure.
Can you explain in a just like 3 sentences, what does sugar do to the kidney? Why is it a toxin to the kidney? We understand with the heart, there's the inflammatory, there's clogged vessels. Is it the same process that's happening?
Very similar. I got really excited about reading about dopamine, which is a hormone that sugar induces, and it's that pleasure thing. Well, that's nice, except that when you have too much, it's going to hurt. So that's a piece of it. The tubules are where the action is. So the way the kidney works, there's this clump of blood vessels every bit of everything in our blood goes through that.
This is great. Thank you.
And the glomerulus is this clump that everything has to go through. Some things do and some things don't. Early on, so in stage 2, diabetics may often start spilling protein through this, and it ends up in the urine instead of going back in the body. So
which is why we test for protein, folks.
Absolutely. Yep. And it's very dangerous. I mean, once you have that, you either got to start taking care of things or decline happens, and these are the kinds of things that keep those nephrons from turning into scar tissue. And so, there's a lot of enzymes in tubules. So it goes through the glomerulus and then it goes through the system of tubules. It's really complicated. Honestly, after years of studying this, I'm still learning these complicated things. And the kidney tubules are a lot like the small intestine. We all talk about SIBO these days. Well, I think there's a very similar thing that happens. And so anything that comes and torments the kidney tubules are going to alter how everything works. Remember, insulin is a consequence of sugar metabolism. So if our sugar isn't processing correctly, we get a boost of insulin. You need insulin. When you have too much of it, you have damage, cardiovascular issues. The blood vessel linings get damaged by sugar as a result of this. These tubules have enzymes that just get messed up, not working right. And so the consequences are huge. So, sugar is 50% fructose, and fructose is bad news. And this is an aside. I used to tell people, well, fructose is okay, but not necessarily, glucose. But I was wrong. And over time, we know fructose messes up the liver. Non-alcoholic fatty liver is a sugar thing. There's dementia that happens. It messes up the lining of blood vessels and it raises uric acid, which means you're at risk for gout. And that is an issue with kidney disease because uric acid is lovely stuff. It's actually an antioxidant unless it gets too high. And then the oxidizing is chemical mumbo jumbo for things rusting inside, in essence, and turning into inflamed, irritated tissues that end up scarring. And, and so there's so many things that can happen. I was reading a bit about the cognitive impairment and loss of neuroplasticity with eating sugar. So you think, wow, I got all this energy. I feel good because it brings on dopamine, and then you crash. And a whole bunch of chemistry happens in that crash. And, I used to see this with people who were feeding their kids too much sugar. The kids weren't eating the right kinds of foods because they were full. Yeah. And, and so, the combination of salt, caffeine, and sugar really puts us at a big risk.
Can I just go back? Well, another thing that you mentioned was the melatonin. So how does that fit into this?
It's the same thing. Its final production is in kidney. And so with decreased function, you end up having decreased melatonin. And
which affects your sleep then.
Exactly. And sleep disturbance is CKD. It's a huge thing.
I had no idea about that.
Yeah, it's absolutely part of this. And, I've done so much research on what happens to somebody with CKD who doesn't sleep. And it just turns on all kinds of pathways that irritate the body. It's not a good thing. And so, in my working with people with kidney disease, I kind of have, this 12-step program, which includes sleep and hydration and diet and toxins and educating yourself, exercise. There's more meditation. And funny thing, some of these enzymes that are caused by too much sugar are actually modulated by all these things. These lifestyle things are really medicine. And so a lot of it is really deciding that you love yourself enough to take care of yourself.
So just to go back now, so we've got chronic kidney disease, stages 1. So you mentioned that by stage 3, you have less than 50%. Well, you have like 25%. And then if nothing changes, then eventually the kidney becomes scarred in the same way as the liver becomes scarred. And then you've got kidney failure. Okay. And when that happens, then what happens then? If somebody says, yeah, so what? So why is that a big deal?
Generally, the risk of heart disease is enormous in that way. And so strokes, congestive heart failure, and heart attacks, atherosclerosis are known. And so, it's not trivial. The immune system is dysfunctional, so more risk for infection, non-reactivity to vaccines. There's just such an array. And not that every single person with kidney disease is going to get every one of these things.
Yeah.
But what I'm finding is if we don't look, doctors, this huge array. And I encourage patients, ask for these things.
So I want to know about your solution, but before we get to that, I just want to get to worst case scenario. So a person says, okay, I'll go on dialysis. I'm assuming that some of these things that you're saying that are so important, dialysis isn't going to be able to address that. Like It's not going to be able to deal with the melatonin disruption or any of these other things. Am I right about that?
And it's not fun.
No.
People on dialysis, some of them are like, oh, my life's great, and they're okay with it. But the majority of people are really unhealthy and unhappy.
Yeah, that's
very complicated. Their risk of heart disease and death is enormous. And that doesn't mean there are N of one. There's individuals who do fine. God bless them that they do fine. And that on my account, at my age, I was like, no way. I'm for broke. And that was the aha.
So the dialysis would be like just keeping the person alive, but all these finer points, cognitive awareness and mood, all these things cannot be addressed. We need to do it the proper way.
I'm sure that dialysis improves a lot. When you hear people say, wow, all these symptoms I had have gone away, but give it a little time and another scenario comes back. You have to change your diet all over again. And the thing with earlier kidney disease is if you recognize the few things that really can improve function, it's not that hard. It just takes, you got to want to do it.
Okay.
Patient willingness.
So one more question before we get to what should we do instead. What about sweeteners? Can they also cause kidney damage?
As far as I'm concerned, some of them are really hepatotoxic. They mess up your liver. And it also continues the craving. Some of the ones that I'm more happy about, I don't like the chemical ones. Stevia, I don't like the extract, but we actually buy a pound of finely ground stevia leaf powder and I bake with it. It has a little bit of an after bite that I'm not in love with, but if you use cardamom and cinnamon, it works. Monk fruit's the same thing. I'm not in love with it, but it's, I can use a little bit of coconut sugar in something I'm baking and monk fruit, and it's really sweet. And I hardly used any sweetener. So, the chemical ones, I'm just going to say, be wary. Toxins hurt kidney.
Okay. And sorry, one more question before we get to what to do. How does the kidney, if you can just maybe clarify again, how does the kidney affect mental health, like cognitive awareness and mental health?
All of the things that we've been talking about, changes in insulin, changes in blood vessels, cardio, circulatory things, cytokines that are formed because the kidney is concerned and inflamed and worried, go systemic. So a lot of things.
They're like parallel patterns.
And I kind of think of it as like the heart, the kidneys, and the brain is one organ system. Just kind of, they do it a little differently. But one of my really dear friends is doing similar work that I'm doing with kidney with brain. A physician who actually had severe Lyme and lupus and became demented, even though she actually is a dementia researcher. And when we speak, it's amazing, the similarities, some of the things that we do to adjust the chemistry. It's the same. We're talking the same language. And I think it's the same thing for heart. We're looking at blood vessels that are getting inflamed. In between the structures, there's fibrosis. They call it interstitial fibrosis. So that doesn't help either.
Yeah.
Your blood vessels want to dilate and constrict. They can't because they're scarred in. It's kind of like they're cemented. And that can happen because of kidney affecting brain. There's epigenetics, which is what the soup we live in the world, and the genetics, which is, the wiring we came with. That interacts, and there's so much that we still don't know. That looking at kidney from a genetic perspective, if you have certain genetic defects or your lifestyle has induced certain things that aren't working right, you can end up being more vulnerable to having kidney damage, where the person sitting next to you experiencing the same things will be fine.
Yeah. Well, I do want to say that you've just made this triad of brain and heart and kidney. And I really appreciate our talk today because we have not known anything about the kidney and you're bringing this to the fore. So one more question before we get to the renology, you call it, the treatment. You mentioned something about the gut biome and the kidney. How does that play?
Enormous.
Yeah.
I love this. This actually, when you asked me what were my ahas, my oncologist, who's an integrative doc, she includes a lot of nutrition and meditation and etc. She just said to me, wait till you get a load of what the kidney does to the microbiome.
Wow.
That was her way of patient education on my case. And that was the beginning of an enormous dive. There is so much information about the gut-kidney axis.
Oh, tell us.
And, so basically, uremic toxins, these are an array of so many things that we don't have time to go into it, but know that the body makes things. So you eat something, it metabolizes, and the body makes things that maybe for somebody with normal kidney function's okay. But if you have decreased function, you're going to have an accumulation that will cause breakage to the tight junctions. Tight junctions mean, the colon's a tube.
Like the leaky gut syndrome.
And that's leaky gut. So those junctions are proteins, and the uremic toxins break that. All of a sudden, you have leaky chemicals that you should poop out that go in the blood, circulate, and because the kidney's vulnerable and gets every drop of blood repeatedly all day, it's getting through tubules and harming them. So, there's things from amino acids, from the little parts of protein that are causing some toxins that we know cause heart disease. 30 times worse when you have kidney disease. So basically it's like, I call it the great exacerbator, it just like amps up the danger of other things, and so one of the first things that we got into in my household was fermenting foods. Now, there's a good use for sugar. You want to know what to do with your sugar? Feed it to the bugs. They make you healthy probiotics that can heal your gut. There you go. And so these axes are important, the kidney-liver axis, the kidney-brain axis, the kidney-heart axis. It's so involved. They even have names for this now. And so, we know that sugar does not help the gut microbes. And so the thing about that is there are healthy microbes that give us things like vitamins and antioxidants and anti-inflammatory chemicals that helps us. And then there are bad microbes that often come from eating stupid, from breathing stupid, from this life that we really shouldn't be indulging in. And those bugs cause inflaming molecules and trouble. Just understanding that changed, that was like, okay, sign me up. And so again, I keep getting back to it, is decide you care enough about yourself to do it.
Right. Well, that's where we are now. Let's talk about your, I think you're calling it renology.
Here's what I thought. Nephrology, bless their hearts, have very sick patients. Very sick. I mean, these people are really over my head in family practice thinking. However, their own documentation says, see your primary care physician until your GFR is 30. In fact, the last nephrologist I saw, meaning the last one, actually said to me, why are you even here? I know, I was a little shocked. Why are you even here? We don't need to see you till your GFR is 30. However, their own literature says, yes, send people to nephrology just to get an evaluation. But the problem is, family medicine doesn't really know enough, and that's not okay with me. And so that's been my mission. I'm working with doctors. I'm trying to write enough so that we can help people. I mean, a lot of the patients that I worked with, is more as a coach in a way, and their physicians poo-pooed what I was saying. They'd come back to me and say, well, they don't even care about this. And so renology was born from a tongue-in-cheek effort to say, renology is about kidney success, not kidney failure.
Right.
Turning vicious cycles into precious cycles. There's my book. And
that's
so
good. I like it.
and so that's a primary care prevention mindset. one of the nephrologists I saw, I'd have to, fly and take taxis. I mean, it was a whole ordeal getting there because I live on an isolated island. And, basically it was just scare. Will you do dialysis when you're 95? Will you do it when you're 85? Could we speak about diet and protein? No, I don't do that. I'm like, wow, we need something else. We need to educate people. And what I found is people are open and willing. They're scared. They don't want to fall into living on a machine. Neither do I. And so it's like, okay, fine. I am going to redo everything. Protein is a huge thing. The kind of protein, kidney disease does much better without meat. So, here goes, a basic part of my life. All right, what do I do? I fell in love with tofu. I'm really good at cooking tofu in amazing ways.
So are you saying actually that if you have any semblance of kidney disease, that a keto diet might not be the diet for you?
Well, you can do keto. You can do a plant-based keto. And I don't think every single person has to be totally animal-free.
Yeah.
But, a good 70%, really, I've seen people dramatically improve. It's so cool to watch, the numbers just go better. It's amazing. Keto can work, but, too much protein is hard. The nitrogen in protein is hard to filter and will damage things. And so when somebody is spilling protein in their urine, even if their quote function looks normal, back down on protein. Fix the kind of protein. In my mind, make it organic. Glyphosate in food damages tight junctions. Why add to this problem? And
so what kind of protein amount might you suggest in a day then? Like if somebody's trying to do what is it, a percentage of their weight? Like what would you say is a safe amount?
We talk about 0.8 grams of protein per kilogram of optimal body weight.
Okay.
Little arithmetic. It's not that hard. And I also really strongly encourage people to use Chronometer. It's free. It is an annoyance to do it. I got a scale. How do you figure out what ingredients went in the soup you just made? My husband is a number brainiac, so that was how I managed to do it. But I really encourage people to do it. It's enlightening.
What is Chronometer? Sorry, what is that?
It's an app. It's a free app online. You put in what you're eating, and it tells you
what the protein amount is.
What everything. I mean,
okay.
Micronutrients, macronutrients, fatty acids. It's amazing. It's really cool. I think everybody. It doesn't matter whether you have whatever illness. It's so enlightening. And
so would an example be like 50 grams of protein a day is okay for an average person?
It depends on your weight, and also condition. Like some people actually with kidney disease will lose muscle mass. And me being one of them, I've begun to increase my protein slightly as my function has gone up. I can handle more. There are some dietitians working with people using these supplements called keto analogs. So they take out the nitrogen out of protein and put a keto group on it. And you can get the amino acid benefit, that with the protein, and so not lose muscle mass. And, so it's kind of a balance. You have to drop down protein. Major amounts of protein hurt people. The carnivore fad has brought a number of people to me.
Yeah. Okay. Well, that's kind of what I was getting at. So you're saying that in terms of renology, a good lifestyle and looking at diet, one would be reevaluate your protein and make sure that it's not too high. What about fats?
Fats is interesting. For a while, I was really a proponent of low carb, high fat.
Yeah.
But then I started realizing, in some ways, kidney people need some carbs. It's personal. If somebody's obese and, blah, 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 then you personalize it. But generally, to balance out lowering protein and caution with fats.
Okay. Because
too high of a fat diet causes dysbiosis, messes up gut bugs. And that, LPS, you might see that on things. It's a problem with some bad bacteria, and those molecules will hop into the circulation and cause trouble elsewhere. And so, I've kind of been modulating, I think a little bit of saturated fat's a nice thing in a diet. I just found out today from somebody, pistachio nuts are a good source of good saturated fat. We use ghee. but not much, but I think caution with polyunsaturated fats. They cause inflammation. Why add to inflammation when you have kidney disease? Inflammation is not your friend. In our household, we use olive oil, the nice refined olive oil, but not to cook with because it can mess it up when you heat it. I love sesame oil. It's a little bit higher in omega-6. So, seed oils, you got to be careful. Avocado oil seems to be my go-to. And, coconut oil just seems like a better idea on the outside than on the inside. But
okay, so beware of proteins, not so crazy on the fats. And what else would you suggest in terms
salt is a huge thing.
Oh, talk about salt.
I just found this out today. I'd heard it, but it just got in my head better that salt and sugar in the kidney tubules interact and make for more trouble. And, as soon as you hear somebody has protein in their urine, drop the salt. The tubules have transporters, so there's stuff in a tube and it has to get out of the tube. There's these little, like little doorways, and you have to know what to ask the doorman to get through that door, and they can break. And they do break with kidney disease. And so then you have issues, if you have too much sodium in your blood, that you're not peeing it out, that's a problem. If you peed out too much salt, and it's very complicated. And I think that's why people don't know about kidney.
Yeah. This is going to be a super stupid question, but what about people who pee all the time and it's not because of diabetes? Is there something about that? Like, I don't know, is that a symptom of something other than diabetes?
Definitely. Yeah. There's a big differential diagnosis, but, there are chemicals induced with CKD that can actually, vasopressin, antidiuretic hormone. So if you don't have enough antidiuretic hormone, you diuretic, meaning you're peeing too much.
Yeah, okay.
And there's a balance. Your sodium gets too low, your potassium gets too low. That's a problem. With kidney, it's more of a problem if they go up. But there's not, it's not 100% anywhere, because I've seen people with all of these possibilities. The other thing that's really important to know is alkalinize your diet. Alkalinize every day. And with kidney, the excretion of acid, which our lives are full of acids. We need acids. They break things down. These aren't bad things, but when they get out of balance, they're harmful. And so with the advent of kidney, you can accumulate too much acid, and that damages everything.
So what does that look like in a diet? If you however you say it.
Alkaline, get back to basics. It's, acid-based, and basic foods are plants. Plant-based diet is wonderful. How to get more acidic? Grains and animal foods. So again, a reason for plant-based diet. And you can do things about it. A half teaspoon of bicarb in a half a cup of water a day can actually make a difference. I've seen people, and here's a cool thing. When I started doing bicarb, my lab wasn't even that bad, but my uric acid was elevated. My potassium was elevated, my phosphorus was elevated, and my parathyroid hormone was elevated. I started taking bicarb. They all normalized.
These are all markers that people listening should ask their doctors to be checking, it sounds like.
Worth it. And they deny, it doesn't happen in stage 3. Yes, it does. And maybe it's not all the time, but if you're the one it's happening to that got neglected, that isn't okay.
Now, what's your opinion about drinking lots of water? People will say you got to drink tons of water, 3 cups a day, or 8 cups a day.
Caution. Hydrating for kidney is absolutely essential. It dilutes things that are dangerous in the blood. So it actually does work.
Okay.
But you can overhydrate and lower the chemistry of your blood enough to be dangerous. And so, how do you know? Okay. Monitor, I've had people get dipsticks and actually monitor, on Amazon for $10, you can buy a tube of 100 dipsticks, and there's all kinds of cool stuff. You can monitor your glucose in your urine. You can monitor the pH in your urine. You can monitor the protein in your urine right in your own bathroom and be more proactive.
Okay. What about coffee?
We're just now reading Michael Pollan's new book, and we're loving it. We read out loud. And reading the part on caffeine last night, it's like, wow, I used to have a cup of coffee welded to my hand. slept with it. I went everywhere with it. And I finally realized it really does raise your blood pressure. It could be transient. So to be honest, I went back to my 5-year-old coffee habit. I have a cute little cup. I have about 1.5 centimeters of coffee, about 2 centimeters of water, put some soy milk in it, and a little bit of stevia and cardamom and cinnamon, and it works. It's just like when I was a little kid, and so it's dose related. These are the days everybody thinks coffee is wonderful. And I'm not convinced that everybody with kidney disease does well. Because remember, one other thing that coffee does, which I used to enjoy dearly and miss profoundly, by the way, is it stimulates the nervous system. Kidney disease in and of itself is a, quote, autonomic nervous system disease. That means too much adrenaline. Sugar also does that, and that's another reason to avoid it. But, coffee and sugar together, favorite. But it's, once you induce the nervous system to be on agitation as opposed to relaxation, you're ending up causing heart damage, blood vessel damage, brain damage, eye damage, it's slow. So, it's like the frog in the boiling water, I'm fine.
Okay, so besides the foods that we've mentioned, what else would you say fits with the renology plan? So we want to make sure we're eating a lot of the things that we've already talked about. What else would you include in your lifestyle change package?
Well, the sleep issue is huge. I like people getting an Oura ring, those rings you can just self-monitor. It's kind of cool. I got one and I was like, wow, okay, my REM isn't that good. So I adjusted so I can get better REM. So sleep is important. No excuse. Don't be drinking caffeine at night and blah, blah, blah. Exercise is not optional. Excessive exercise causes lactic acidosis, and not a good thing for anybody, but for kidney especially. But something daily, whether, resistance and aerobic, yoga, and relaxation, meditation, prayer, whatever that whole arena is really important because of this autonomic overload thing, that knowing how to just quiet the soul, quiet the mind, quiet the emotions is medicine. It truly is. We don't encourage people enough in medicine, but this is a drug. It's a drug called meditation. Sit and listen to the birds, watch the clouds. So stress reduction goes along with that. Hydration we've talked about. The diet thing is the hugest of it because it's a big array. Learn how to study, look things up. I started with, my potassium's up. I better look this up. And fun and creativity and recreation.
Okay.
AK, taking time. My husband and I take Saturday every week and we turn off our computer. We do our work, garden, laundry, cooking will do. But it's a date. So we actually, because one of the things on my renology list is relationships and maintain healthy, loving, comfort, self-comfort in relating. And so we kind of, in evolution, came up with a day that we just turned off.
So basically you were able, by applying all of these principles, you were able to improve your kidney function from 25 to possibly 50%.
About at 30, and about 25% to just short of 50%. I'm pretty excited about that. And, I've continued to learn and add new things. And so as I'm learning it, I'm sharing it.
Yeah. And so what you're doing now is you're seeing people primarily focused on kidney disease. Is that what you do now?
That basically doing peer-to-peer with other physicians, more coaching and counseling than actually doing the real primary care.
Yeah.
But educating physicians is really important to me because that, and other people, I have a group on Facebook for kidney clinicians. No, for clinicians who take care of people with kidneys, not necessarily nephrologists, though we have 5 of them. They're more quiet than most of us. What they're dealing with is really later stage. There are a few functional nephrologists who are starting to get excited with this, and I'm hopeful. I have 8 years to communicate with nephrology, so part of the tongue-in-cheek about renology, they're starting to give up the word renal. They're going to just go to kidney. I studied the history of kidney disease and the rains. It's in the Bible. the reins are considered a mystical organ. It's always been hidden. Like still, we ignore kidney. It's always been that way. And so I love the mythology in medicine and how we got to where we are. So I thought, fine, they're going to get rid of renal. I'll take it. So I said, okay, I am in admiration of nephrology, but I also don't appreciate the neglect in the earlier state. And I've decided that has to be a separate line of thinking. It's a different specialty. And it really is a more holistic mindset that is family medicine. Family practice has to be holistic. You can't say, I don't really care about your eyes because all I'm doing is taking care of your left nostril. I don't have that luxury. And so it's a perfect, holistic everything for kidney really helps. Personal holism. I expect the clinicians I see to embrace all of that with me.
Do you have any pushback on your emphasis on earlier treatment through functional or nutrition?
There's much more interest in the functional community than I have found in the allopathic community. In fact, I've even been ridiculed. Why would you even bother? And that's disturbing to me. That's not medicine to me. That's, go back and start over because, I make a joke. My name's Robin. I call this early bird medicine.
That's great. I love it.
The earlier the better. With everything. Great. And I was like known as this great diagnostician. Why? Because I was like, wait, this doesn't look good. This is a subtle thing here. Let's follow it through.
Yeah. Well, like early bird medicine, like what we do in general medicine is the moment somebody's got protein in their urine, we throw them an antihypertensive. We don't talk about medication or changes in nutrition. We talk about what medication we should put them on. And then we talk about dialysis. And then we talk about transplant.
Exactly. And that's unacceptable. It really is. Yes, treat the hypertension, but a lot of these things that we're talking about will actually modulate. And I'm into supplementing with kidney disease. Yeah. There's a lot of useful things. Vitamin D for one. Magnesium is a lovely one. Early on, you don't have to worry. Later on, very sick, magnesium can go up because you're not excreting it. Earlier,
right.
Stage 2 and 3, it actually benefits the blood vessels.
Right.
CoQ10 is a wonderful one with vitamin E because those two together protect the heart, and congestive heart failure incidence with later kidney is huge. I don't want to wait till I have congestive failure. What do you do to modulate it before? So one of my ahas was this. I grew up in New York and New Jersey. You can probably hear it in my voice. It's like, what are you waiting for? It's like, what are we waiting for? Let's get on with it. What do you have for me now? And that's what patients, I'm on Facebook groups with thousands of kidney patients. And so often it's like, nobody's doing anything for me. I asked about this. They said, don't worry. It's like, what is this, Mad Magazine? I am worried, worrying meaning proactively, because fear is a really bad thing for kidney. In Chinese medicine, fear is the emotion associated with kidney. And so, and in Chinese medicine, kidney is a generative. It's like really a root cause of a lot. And so to honor the kidney function and its role in managing the rest of the body in some way is a wonderful. I'm so excited about this because I really didn't think about kidney that much. It turned out I asked an old doc mentor of mine when I was first diagnosed to help me think. My brain was not working well. He got some of my old records, and what we found out was I had been in stage 2. I had a GFR of 78. Well, until very recently, lab work only said GFR greater than 60 normal. But there are formulas and you can figure it out. But, I've heard from other doctors, 57, that's close enough to normal. Don't worry.
Yeah.
No, it's not normal.
Yeah. Well, one of the messages I'm really getting from what you're talking about here is that kidney is, aside from the fact that it has its own value, it's a really good indication of where there's other problems, because you said they're working together, this triad. So including to myself, where can we find more information about this that you're talking about, sort of on a layman's term? Like you mentioned Facebook groups, or where can people find out more about the kidney, not just for those of us who are living sugar-free, but, trying to respond?
Figure it out. There are a few resources. There's a group of functional renal dietitians who are really putting out some lovely information. Renology is the name of their business. And honestly, there are some naturopaths who really have embraced this in the natural lifestyle.
But your work.
I'm working on my book. I'm slow. Anybody listening good at editing, get in touch with me. I have finally really started taking it all and putting it together. I have several projects. One of them is called My Kidney Kitchen. That's the one I want to put out first, because it's what did I find out and what have I done? So I can go through, here's my kidney kitchen, here's what's under the sink. Toxins under the sink will hurt you. Here's my spice cabinet. Here's my supplement cabinet. Here's my tea cozy. Here's my pantry. Here's my bathroom. Okay, it's not the kitchen, but chemicals in there. Here's my kidney garden, because we have a garden and I grow a lot of kidney friendly stuff. I mean, there's weeds in my garden that are kidney medicine. I found out from my local farmer whose sister is on dialysis, said, oh, you want this? She comes over with this pile of weeds that her ducks eat. And I looked it up and it's amazing. I mean, one of the things I didn't mention is sugar induces oxalates, and that's kidney stones. I mean, sugar will exacerbate kidney stones in anybody. And if you have CKD, way more. Yeah. So there's all kinds of things that we can be doing. You can't do them all.
Yeah. But just tell me, is cauliflower and Brussels sprouts, are they good for the kidney?
They are. Here's the thing to know about.
I eat them a lot. I want to know.
Yes. So, my issue was the surgeon, sadly, unfortunately, damaged my distal bowel.
Oh.
Badly. That messed up my gut. So as a result, this patient had elevated potassium at a time when they said, oh, people in stage 3 don't get elevated potassium. People, I'm sorry, but I have elevated potassium. And elevated phosphorus really challenges diet. And so not everybody has that problem. I just got my potassium normalized and I can eat avocados finally. I live in Hawaii where they grow, and I'm like, hey, so you really have to know your own personal holes in your bucket, and they're going to be different than mine. So it's like detox, get rid of chemicals in your life, avoid fumes and smearing toxic stuff on your body.
And sugar, don't forget that sugar.
And sugar is considered a uremic toxin. And like I said, the best use of sugar is ferment food. We make sauerkraut, we ferment green beans and chayote and, whatever we grow, we end up fermenting it. The bacteria that naturally grow, they're lactobacillus, which is what's in yogurt, which has, a whole array of benefits. And they eat the sugar and it's gone. You're not eating sugar. If you don't, like things like kombucha, you buy kombucha, it's a sugar drink. When we make it, it's so sour, I don't like it.
Yeah, for sure. You definitely have to check out that content. I eat kimchi every single day. It's like one of my regular daily practices. Yeah. So we will make sure. Thank you so much, first of all, for being here, because you have just enlightened. My brain is exploding right now with new information that I was completely unaware of. And I'm so excited to share with individuals that I work with and our audience. We do have a signature question, and I've kind of modified it for you. So if you could tell a younger version of yourself something about sugar or something about the kidney, what would it be?
Despite the fact that you have menstrual cramps, don't take NSAIDs.
Wow, that's right, NSAIDs. Whole other topic.
The irony is, before I went to med school, I did a master's family nurse practitioner program, and guess what my research was? NSAIDs, they had just come out. Miracle cure for menstrual pain, and I was miserable. Cool. Bad idea. Quit eating sugar. I didn't walk my talk. I did well with protein because I actually ate a lot of plant-based protein for years. I love lentils and I love tofu. I make tofu cheesecakes. I make chocolate tofu cheesecake that's good for you. We call it rice and beans. I don't know. What else would I say? Drink more water. Hydrate better. Quit BSing yourself and go to bed earlier. That's a good list.
I love it. Those are great answers. Thank you so much for being here, Dr.
Likewise.
Rose.
Thank you.
Thank you, guys. This was really fun.
Thanks for joining us this week on Food Junkies, Recovery from Food Addiction. Make sure to join our Facebook group, Sugar Free for Life support group, I'm Sweet Enough. You can subscribe to our show in iTunes or Stitchers. That way you'll never miss an episode. While you're at it, if you found value in this show, we'd appreciate a rating on iTunes. Or if you'd simply tell a friend about the show, that would help us out too. Don't forget to pick up your copy of Dr. Tarman's book, Food Junkies, which is available on Amazon. If you have any additional questions, both Molly and Clarissa are food addiction professionals and work one-on-one with clients. You can find their websites and email addresses in the show notes. Be sure to tune in every Friday when our new episodes drop. As Vera loves to say, the power is ours.